Hi, I'm Dr. Jeff Fialkov, and I'm going to talk to you a little bit about the recovery after rhinoplasty. When performed by a skilled facial cosmetic surgeon, rhinoplasty can help achieve symmetry and balance in one's face. However, recovery can take some time, and results of rhinoplasty surgery aren't always immediately apparent. Pain and swelling should be expected after just about any type of surgery, including a nose job. The pain generally is moderate to mild after rhinoplasty, and usually resolves within the first few days. The pain experienced after rhinoplasty surgery can be controlled with over-the-counter medications, such as Tylenol. Your surgeon may also prescribe a stronger medication for your pain. Only take medication that's approved by your surgeon. Swelling and even some bruising can be expected and can often worsen on the second or third day following the procedure. The amount of bruising varies from one patient to the next. It can even extend down the cheek area and even lower. However, if only the septum or tip are operated on, bruising generally is very, very mild. Here are some ways you can reduce the swelling and discomfort after rhinoplasty. First, plan your first couple of weeks following the surgery ahead of time. You shouldn't do anything other than very light tasks. Avoid any heavy lifting, any heavy housework and exercise, at least for the first 2 weeks following surgery. After a few days, you can go for walks, and after 2 weeks, light exercise is permitted. For the first week after the procedure, you'll want to sleep on your back with your head elevated. Make sure that you get plenty of rest. When taking a shower, avoid hot water, and keep your nose and face dry for the first week. Try to avoid any situation where your nose might be bumped or hit, and be careful when dealing with children or pets. Be careful with what you eat. During the first week, restrict your diet to soft foods. Avoid foods that are difficult to chew, such as steak or crackers. Try not to sniff excessively or blow your nose. And gently place a small amount of antibiotic ointment or pure Vaseline around the nostrils to prevent them from drying. Swelling can be minimized with the use of a cool, clean compress. Apply it gently to your cheeks and closed eyes every 4 to 5 hours for the first couple of days. Never, however, place the cold compress directly onto your nose. You can take preventative measures before rhinoplasty surgery to minimize bruising and swelling later. For at least 2 weeks prior to the procedure, avoid taking ibuprofen, aspirin, or any other medication that may cause blood thinning. This also includes herbal remedies, such as green tea and ginseng. Your rhinoplasty surgeon will likely recommend that you avoid such medications after the surgery as well, and just stick with Tylenol or the prescribed medication. Most people who have had rhinoplasty agree that achieving an attractive nose is well worth a few weeks of swelling and a few days of discomfort that typically accompany it. Thanks for watching.